Hello and welcome to Health Matters. It's nice to have you join us again. I am Mary Alale Yusuf. Ebola virus has been in the news for some time, with a current death toll of over 700 in Guinea, Liberia, and Sierra Leone. It is severe, often painful, and 9 out of 10 sufferers have been known to die. It usually breaks out in West and Central Africa, and fruit bats are thought to be the natural hosts. There is reported to be no cure or vaccine for Ebola. Nigeria had her first case in late July, an American who traveled in from Liberia. He was quarantined in a private hospital and later died. Joining me on the show is Dr. Pt.1, a consultant clinical microbiologist in the Lagos University Teaching Hospital. You're welcome to the show, Dr. Oshun.
Thank you very much, Mary.
A very sobering topic,
yes,
but we must discuss it at any rate.
Yes.
Let me first ask, is this disease limited to Africa?
Yes, Ebola virus disease, in terms of outbreak, most of the outbreaks have occurred in Africa. That's what I would say. Most of the outbreaks have occurred in Africa. It's a disease that is mainly limited to the African region. Most of the other Ebola disease that have been seen outside is the other virus that resembles Ebola, called the Marburg virus, which they are in the same family. So they've seen diseases like that in other parts of the world. There's also a strain called the resting strain, which has also been seen in other parts of the world, but these have not been known to cause outbreaks.
Is there a reason why it's endemic, so to speak, to Africa? What are the features of our location, of our geographical location, that make Ebola, thrive in this area?
I would say if you look at like you mentioned, the natural hosts, the fruit bats, then it's also been found in animals, most especially primates, like the apes, the chimpanzees, and the monkeys.
Are they also natural hosts?
No, they are not natural hosts. They are not the natural hosts. They are also infected. They are usually the ones that infect man. So man usually gets the infection from an animal, and then human-to-human transmission now starts. Okay.
So those other animals, you could call them just carriers. Do they get sick and die?
Yes, they get sick and die. Okay. They are not carriers. They get sick and die. They are also affected by the disease. So they get sick and die. But it's the fruit bat that a lot of people have been saying most likely is the natural reservoir. Okay. But it's still open up there, yes.
Now, we've learned that it can be transmitted by fluids from an infected person, blood, sweat, and other things like that. But I want to know, is it when the fluid touches the skin, does it pass through the skin, or does it have to be ingested? How does it enter, how does it infect a second person from one infected person?
Thank you very much. The infection is spread through blood and body fluids. And these body fluids, apart from blood, would include saliva, vomitus, stool from diarrhea. It could also be urine, and also even semen. So if you have an intact skin, the virus will not penetrate the intact skin. It will penetrate what we call mucous membranes, like inside your eye, the conjunctiva, inside the mouth, inside the anus, if there is a broken skin. So those are the places where it can penetrate through your nose, anywhere that there's a mucous membrane or broken skin. And remember, even though it does not penetrate through your skin, if it can be carried on your hands. So if it's carried on your hands, you rub your eyes, you rub your nose, you rub different parts of your body, so you could get infected.
So that's where this washing of hands comes in.
Definitely.
Once you wash your hands, you are safe. As long as you don't put it all around your face.
Not just washing it once, you just keep on washing.
Keep on washing.
Yes, because the virus could also be on inanimate surfaces. The patient's beddings, that's the bed clothing, the patient's clothes, the bed rails, so you could also pick the infection from all that side.
Okay, so that brings to mind this next question. How long can the Ebola virus survive outside of a host?
Outside of the host, it doesn't survive long.
Minutes, hours, seconds?
It can survive hours to few days. but not weeks.
Long enough
Not,
to cause
yes,
damage.
So, but you must also understand that this virus is shed through the secretions of the infected person continuously. So it's not just once that the virus is shed. So as the person is talking, saliva is coming out of his mouth, the person is vomiting, so the virus, and of course, depending on the quantity of the body secretions, also determines how much of the virus comes out. Yes.
Okay, there are a couple of early and late symptoms. Could you quickly run us through some of these?
Yes, the early symptoms to watch out for. First is fever, usually high-grade fever. Then the person could have intense weakness, that's lethargy, headache, nausea, which could progress to vomiting.
All these are early symptoms?
Yes.
Then what are some of the late ones?
The late symptoms would be the person starts bleeding. Usually, he may vomit blood, he may be brushing and have bleeding gums, and he could have bloody stool. So once blood starts coming out, sometimes rashes that we call Pt.1, rashes that can have small, tiny capillaries that are open with blood inside. So that's what we call Pt.1 rashes.
All right. Now, can somebody who has early symptoms infect another person? Just fever, the high-grade fever, maybe the nausea and lethargy. Is that person infectious to another person at that point in time?
Yes, once the symptoms starts with the high-grade fever, nausea, vomiting, headache,
well, definitely vomiting. But I'm talking about before the vomiting starts, before the person actually starts to bring out stuff like diarrhea, vomiting, that kind of thing. Maybe just high-grade fever and nausea, you know, lethargy. Just enough for you to be thinking, could this be malaria? At that point, can the person infect another?
Yes, but you must also understand that